Hello, welcome back to our weekly Sunday sit-down Q&A where we answer your questions.
Yeah, this week we are talking about birth anxiety and
also developmental milestones and how to track them if your baby was born a little bit early.
If this is your first time meeting us, I'm Sarah. I'm a board-certified OBGYN.
I'm Kurt. I'm a board-certified pediatrician.
And we are the Doctors Bjorkman. So let's get to it. This week, our first question comes from Alex S. She said, "We are so grateful for you guys. Any tips on coping with birth anxiety for a first-time mom? Currently in counseling, but wondering if you have any other tips to ease a worried mind. Thanks." So first, congrats.
Yes, and it's awesome that you've already said, hey, I need help. I'm going to talk to someone about this.
Yes. So my first tip is always get professional help, see a therapist or a counselor. I feel like everybody should have a therapist. And so normalize getting and taking care of your mental health. So you're already doing that, and that is awesome. Some things that help me and seem to help other moms. So you mentioned, I'm a first-time mom. I have this anxiety. There is this fear of the unknown. If you aren't in medicine, you kind of have no idea what to expect. And if you don't have other mom friends or people kind of in this same season of life, it may not be something you talk about. What really happens with birth? What are the different options for birth? What is labor? What's pain like? What's recovery like? And that fear of the unknown or just not knowing is really hard to wrap your mind around. And so everyone's flavor of anxiety is a little different, but many mamas find that getting a lot of information, feeling empowered is really helpful. So they know what to expect, and that takes some of the fear away. And you can do that by checking out all of our videos. We talk about a ton of first-time parent topics to try to get you through that and kind of what we experienced. Talk openly with your girlfriends or other moms or parents who have gone through birth and what it was like for them if you can. Read lots of different books. One of the ones I really like is a book I edited by Motherly, The Guide to Becoming Mama. It's a great pregnancy and postpartum book for you. And really important is to really talk with your OB or your midwife or whoever that is. I find I feel more comfortable when I really trust the person who's taking care of me. And then you just know you have someone on your team who's going to be there to navigate you through that process. And that is what your OB or your midwife is there for. That's their job. They want you to feel comfortable and they want you to have a good birth experience. So talk to them about these fears. Hey, I'm a first-time mom. I have all this anxiety about birth. How could you talk me through this? Maybe you can get a tour at the hospital. I know now kind of as we're moving through this season of COVID, things are opening back up again. Maybe you can go in and see a room. Maybe then there's some birth class there at the hospital so you can meet the nurses and understand, hey, do they have tubs here or balls or, what are the different things that are expected during labor? You can see the hospital, you can touch it, you can feel it, and it's a real thing. You know how to get to labor and delivery. So just trying to make yourself familiar with what is going to happen really is empowering because you're like, oh, I know sort of what to expect. And then I always say, expect the unexpected. Labor, you never know what you're going to get. And so that goes right back to make sure you trust that team taking care of you to guide you on this because we want you to have a good experience. We also want you to be safe and we want your baby to be safe. And those are always kind of those three goals: safe mom, safe baby. Make sure we're having a good experience and everyone kind of knows what's going on. So I wish you the best. You can do it. You can do it. Learn as much as you can in the next few months and you'll be ready to go.
Okay, good luck. Okay, next question. This is coming from Paige Schaefer. And Paige says, I have twins who were born 6 weeks early. Do I start introducing baby foods based on their actual age or their adjusted age? They are currently 12 weeks old. Awesome. Well, congratulations on your twin babies.
How are you doing?
Hopefully you're getting some sleep. I'm sure you're very busy with them.
Busy, yeah.
So when it comes to children born early and developmental milestones, I guess the first thing to say is that there's some really nice information that we can link in the description about developmental milestones and tracking them for your child and kind of what to expect at each stage. For children who are born kind of in that late preterm stage, so this is 37, 38 weeks along. Generally, you're following pretty much the same developmental milestones as if they were born right at 40 weeks. We say if they're born 3 weeks early or more than that, then it's good to use a corrected gestational age.
So that's 36, anything before 37.
Yes, exactly.
Okay.
Yep. So say your baby was born 6 weeks early, as you said. So then you would say, hey, when they're 12 weeks old, you're actually going to look at milestones for someone who is a 6-week-old. So instead of being 12, if they were born on their due date, they'd only be 6 weeks old. So that's our corrected gestational age.
So you correct to the due date?
Yes.
Okay.
And then using that as a reference for developmental milestones.
Okay.
Having said that, I think it's also really good to be aware of that the developmental milestones are not set that, oh, your baby must crawl on this date, they must walk on this date, they're going to eat solids on this date, those kind of things. And so, for instance, thinking about starting solids, we like to say between 4 and 6 months, most children are ready for that first kind of taste and to start working on some solid foods. Some children, well within normal, may not start solids until maybe they're 7 months of age.
Right.
Now, your children who are born 6 weeks early, so then maybe that 4 to 6 month window is actually going to be 5.5 to 7 months, 7.5 months of age. And so the biggest thing with that, and even if you go back to our starting solids video that we did couple months ago, the biggest first steps is really just that your baby's showing interest and that they can kind of do the other things like sitting upright, have good head control. And so it's not so much about how old they are, but the things that they've already been able to do. One other plug, if you are a parent of a baby who was born early, it's always great to be checking in with their pediatrician. You can ask them, hey, how do you feel like they're doing? Are they catching up? Where are they at on that? And then also early intervention programs to help make sure that they're getting speech therapy, physical therapy, occupational therapy, if that's something that they're falling a little bit behind or if they haven't caught up on their milestones. Generally say following the corrected gestational age till about 2 years of age is kind of when everyone kind of meets that same thing. So
gotcha. That was my question. When are they supposed to catch up?
So they can get their driver's license when they're 16 years old. They don't have to be 16 in 6 weeks.
Gotcha.
So generally by 2 years of age is when that catch up, we say, hey, everything's probably normalized and that little bit of effect from being born a month and a half early is negligible by then.
Nice. Awesome. Well, hopefully that was some great educational content for you this week. We are so appreciative of your questions and look forward to answering a few more next week. Stay tuned for this week's episode on Wednesday where we talk about a question that we get once in a while of, is there anything you can do to influence whether you have a boy or girl? So we're going to do a whole episode on that one on Wednesday.
See you guys next week. Bye.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.